right, everybody, welcome back. Ready for another deep dive?
Definitely. Always ready to get into it.
Okay, so today we're tackling something that I think we can all relate to. You know that feeling when you kick off your shoes at the end of a long day and your ankles are looking a little puffy?
Oh, yeah.
We've all been there. But is it always just like too much salt or being on your feet all day? Could it be something more? That's what we're diving into today. Edema.
Yep, edema. And we're going to cover the whole spectrum, from the everyday stuff to those kind of scary signs that something bigger might be going on. And more importantly, how to know the difference.
Okay, so let's jump right in. We did our research for this deep dive, and one thing is for sure, ignoring edema can be seriously risky business.
Right. Absolutely, right. Our sources were super clear about that.
Yeah.
Because edema can sometimes be a big red flag that something else is going on in the body.
Exactly. So it's like a clue
Yeah.
that something's off.
Exactly. And especially when it comes to those major organs like your heart, liver, and kidneys, you really want to catch any problems early on.
Makes sense. Okay, so let's say you notice some swelling. How do we even start to figure out what's causing it?
Okay. So the first thing to consider is the timing. Like, how long has the swelling been there?
Okay.
So if it came on really suddenly, like within the past 3 days, 72 hours.
Oh, wow. So pretty recently.
Yeah. That could signal something that needs attention right away.
Oh, no.
Like maybe a deep vein thrombosis, that's a blood clot.
Okay.
Or it could be cellulitis, which is a skin infection.
Yep.
Or even something like a ruptured cyst.
Wow. So sudden swelling. Definitely red flag. Get that checked out.
Yes, absolutely. Don't mess around with that.
Got it. Okay, so what if it's not sudden? What if it's been kind of gradually coming on, getting worse over time?
Okay. So if it's more of a slow burn, that's when we start thinking about those long-term conditions.
Okay.
Things like congestive heart failure, or maybe problems with the kidneys or liver.
Got it. Okay, so the timing is clue number one.
Exactly.
What else? What else should we be looking out for?
Okay, next clue. Location, location, location. So where's the swelling? Is it on just one side of your body, or is it on both sides?
Look sides.
Yeah, that little detail can actually tell us a lot.
Wow. So pay attention to those patterns. One side versus both sides. It's amazing how the body gives us all these little hints.
It is.
It really is.
Fascinating.
And something that came up in the research was that even medications can sometimes cause fluid retention and lead to edema, like certain blood pressure medication.
Oh, absolutely. Yeah, you wouldn't think about it, but common meds like calcium channel blockers, those can sometimes be the culprit.
Huh. So many factors at play.
Me too.
Which is why it's so important to have a good physical exam, right?
Oh, definitely. Yeah, a good physical exam, it helps your doctor put all the puzzle pieces together, connect the dots and see the bigger picture.
Okay, so let's pretend we're the doctors for a second.
Yeah.
What are we looking for during that exam? Like, what are the specific signs?
Okay, so let's say we suspect heart failure. One thing we'd look for is a bulging vein in the neck. Doctors call this jugular vein distension.
Ooh, fancy medical term.
Right. And then we might also listen to the lungs with a stethoscope and hear some crackling sounds.
Okay, crackling lungs. Not good. So that's for heart issues. What about signs that the kidneys might be involved?
Okay, so for kidney problems, we'd want to check the urine for something called proteinuria. Basically means there's protein in your urine,
Okay.
which is not a good sign.
Not good.
And also, we want to see if you're peeing as often as you usually do. Any changes in that can be a clue.
Got it. Changes in urination patterns, kidney problems. What about the liver? What are some signs that the liver might be struggling?
All right, so with liver problems, one of the first things you might notice is a yellowing of the skin and the whites of the eyes. It's called jaundice.
Oh, jaundice.
Yeah, and you might also see fluid buildup in the belly. Another thing we might check for is something called asterixis.
Asterixis.
Yeah, it's this weird tremor in the hands. It kind of looks like a flapping motion when you hold your hands out in front of you.
Oh, wow. So many different things to look for. And, the research also mentioned thyroid problems as a potential cause of swelling, too.
Oh, yeah, definitely. Thyroid problems can absolutely be a factor.
Yeah.
You might notice things like bulging eyes or tremors, unexplained weight loss. Sounds like a whole other deep dive to me.
It really does. It's amazing how interconnected everything is in the body.
It is.
It really is. Okay, so we've talked about timing, location. Now let's focus on the edema itself.
Okay.
One thing our source mentioned was something called pitting edema. What is that?
Okay, so pitting edema, basically it's when you press your finger on the swollen area
Yeah.
and it leaves an indentation, like you're pressing on dough.
Oh, I see.
And that little dent, that pit, stays there for a few seconds after you remove your finger.
Interesting.
And this usually happens when the fluid that's built up in the tissues has low protein.
Wow. It's amazing how something as simple as pressing on your skin can tell us so much.
It is, right? Like, our bodies are constantly giving us these little clues.
Absolutely.
Yeah.
And it's not just about the pitting. We also need to pay attention to any changes in the skin's temperature, color, and texture.
Oh, definitely. Yeah. Those are like bonus clues.
Yeah.
Really important to watch for.
Okay, so give us some examples. Like, what kind of changes should we be looking out for?
All right, so if the swollen area feels warm to the touch, that could be a sign of a DVT, that blood clot we talked about.
Right.
Or it could be cellulitis, the skin infection.
Okay.
Another thing to watch for is discoloration. So if the skin has a reddish-brown color, especially around the ankles, that could be a sign of chronic venous insufficiency. That's a problem with blood flow in the legs.
Okay. Reddish-brown venous insufficiency. Got it. Anything else?
Yeah, so there's this condition called lipodermatosclerosis.
Lipodermatosclerosis.
Yeah, it's a mouthful. But basically, the skin gets really thick and hard in that area, almost like a wooden board.
Oh, wow. That doesn't sound fun.
No, not at all.
Definitely not. And anything else? Any other skin changes to be aware of?
Okay, last one. Early stage lymphedema often causes the skin to have kind of a doughy texture.
Interesting. So many different variations. It really is like our bodies are trying to communicate with us through all these little signs, like a secret language.
It is a secret language that we need to learn to understand.
Exactly. So next time you notice some swelling, remember what we've learned today. Don't just brush it off. Take a moment to think about it. First, the timing. Did it come on suddenly or gradually? Then think about the location, one side or both, and look closely at the edema itself. What does it look and feel like? Are there any changes in the skin's temperature, color, or texture?
Exactly. And, while you're at it, pay attention to any other symptoms that might be going on. Are you having trouble breathing? Are there changes in your urine? Any of these things, if they're happening along with the edema, that's definitely a sign to call your doctor.
Absolutely. Early diagnosis is key.
Absolutely.
And, we've covered a lot of ground today, but this is really just the beginning. Like, did you know there's an actual grading scale for pitting edema?
Oh, yeah. It gets pretty detailed.
It really does.
Yeah.
And of course, different types of edema require different treatment approaches. Definitely a whole other deep dive.
For sure. Edema is a fascinating topic, and there's always more to learn.
It really is. But the main takeaway here for everyone listening is this. Our bodies are constantly sending us messages. It's up to us to listen. So next time you see some swelling, don't ignore it. Do a little detective work. Use the clues we talked about today. It might just be your body trying to tell you something really important.
Absolutely. Well said.
Thanks. Alrighty, everyone. That's another deep dive in the books. Thanks for joining us, and we'll see you next time.
See ya.
Any other doubt, you can ask me. I am Dr. Surendra Nehru, MD physician, trying to create an awareness about insulin. Test can be done
Artlist
only with
IO.
insulin test and C-peptide test. Then only you have to go for fasting blood sugar and random blood sugar. Don't believe in HbA1c. For any other doubt, you can ask me. 996 3721 999. Homa Health Care Center, Hyderabad. Thank you.